I'm Dr. Sonia Anand. I'm a professor of medicine and epidemiology at McMaster University, and my specialty is vascular medicine. Personally, it's always nice to be recognized and receive an award. I think more importantly, it reflects how my work may be seen as being impactful in Canada and for patients around the world. So for me, that's the most important thing. I focus on neglected populations and neglected patients, those patients with peripheral artery disease. And so all of those long nights and weekends, I stay up writing grants and papers and sometimes wondering if it's worth the sacrifice when I see the research results, how it's translated into clinical practice to help patients. And then a bonus is to receive an award like this. It's kind of like the icing on a cake. You really need to have persistence, passion, and patience and patience. So the patience is everything doesn't happen overnight, and I need my patients and my interaction with patients to continually give me new ideas. When I started about 25 years ago, we didn't have very much to offer patients with peripheral artery disease. When I see certain populations who have a high risk of cardiovascular disease, I'm really motivated to understand why. And now I'm moving beyond simply what are the risk factors for cardiovascular disease to trying to understand the population level factors that lead to risk factors. I'm excited to work with communities, typically ethnically diverse communities of lower socioeconomic status, to design interventions that could improve health outcomes. I'm also inspired to continue to work with PAD patients to bring the effective therapies to them and to break down some of the barriers that currently exist. My parents certainly inspired me into focusing on science and a life of service through my career. On the research side, my initial mentor, Dr. Salim Yusuf, inspired me toward considering a career that includes both patient care and research. It's important to stay passionate about the work you do that keeps you going through times that are more difficult, such as writing grants and getting papers rejected. I think trying to bring everything together, which is loving your family, working hard, and living a life of passion, would be my main advice to early career researchers.